Case 5. A 27-year-old woman comes to the emergency department with bruises on her wrists and forearms. X-ray of the chest shows 3 broken ribs. Upon questioning, the woman tells the physician that her boyfriend got upset with her because she overcooked his steak. She claims that she provoked the incident by not preparing his food correctly and asked the doctor not to tell the police or anyone else. What should the physician do in this scenario? Because the patient is not considered to be a minor or an elderly patient, defined as being older than 65 years of age, the patient's right to confidentiality must be respected. Although the physician should make all resources available to her, such as battered women's home and ethical principles of patient autonomy and privacy must be followed. Should the physician contact members of the woman's family or close friends named in the social history? No, the physician should not contact friends or relatives of the patient. Doing so when clearly told not to by the patient would break the principle of autonomy. Also, the physician is bound by the privacy rule of the Health Insurance Portability and Accountability Act, or HIPAA. What are the exceptions to confidentiality? There are a number of exceptions to confidentiality besides the age parameters that protect minors and the elderly. These exceptions rely on the physician's judgment. If the potential harm to self or others is great or serious, then confidentiality must be violated to preserve the principle of beneficence. It is the responsibility of the physician to take steps to prevent harm if there are no alternative means to protect those at risk. What is the Tarasov decision? The Tarasov decision is a law requiring a physician to directly inform and protect potential victims from harm. In this case, for example, if the woman told the physician that she had a gun and was going to go back home and kill her boyfriend for abusing her, the physician would have a duty to inform the boyfriend and detain the patient. What is the physician's duty if a patient has a serious infectious disease and is putting others at risk? Physicians have a duty to warn public officials and other identifiable persons at risk if a patient has a certain infectious disease. These diseases include hepatitis A and B, salmonella, shigella, syphilis, measles, mumps, AIDS, rubella, tuberculosis, chickenpox, and gonorrhea.